Thank you for joining us on Health Diary. My name is Gladys Gashanja and we're coming to you from the Premier Rehab and Wellness Center here in Nairobi. Now, the reason why we're stationed here for this episode and the next is because we'll be looking into the practice of chiropractic. Now, they say generally this is categorized as alternative medicine or complementary medicine, if you may call it so. So we go in trying to understand this practice and also see the benefits it brings to you. Now, before we get to it, here now is a fact of the matter.
In 2014, I started experiencing diminishing hearing, and I was like, simply because I'm very allergic, I thought that's why I'm experiencing the same. So I went to see a doctor about it, and every time I was given anti-allergies. But after a while, I noted that it was becoming worse. I decided to go seek further treatment, and I got to see 23 doctors in total, all of them professionals. And at one point, I was referred to India. They gave me the same results as I had been given in Kenya, that I had a problem with thickening of my skull. I almost got into a depression. So when I came here, the doctor told me that he was going to do some acupuncture, and then after that he was going to engage on the normal practice which they do here, of which I didn't know what it was. But he assured me there were no medications, because I had told him that I'm not going to take any medicine, and I couldn't because I had taken enough medicines. The acupuncture, it worked so well because the pain went away completely, and the linging went away completely. So I came here with an interpreter, a lady friend of mine, and it was tough, even with the interpreter, because I couldn't hear and there was a lot of pain on my ears. When the doctor did the manipulation, I was like, okay, the first time I didn't have any change, and I was like, I'm not coming back. They were just placing and manipulating on every body part, all the way from the head to the toe. I noted that there was a great improvement after the second session. And after the second section, I can tell you, I'm a different person. I can hear. I can be able to go about my businesses.
So, chiropractic is a healthcare profession dedicated to the non-surgical treatment of disorders of the nervous system and or musculoskeletal system. Now, I do not even want to go further from that with the terms and terminologies in this case. I will introduce to you Dr. Hamisi Kote. He is a chiropractor, and thank you for having us in your establishment. Now, I think at this point, we need to establish what is chiropractic.
Chiropractic means done by hand in full. Chiro is hands, and then practic, done by hands. So chiropractic is a science and a philosophy. It's a science, an art, and a philosophy whereby we work with the human body to be able to look for the body alignment. And when you look at the body alignment, we're able to correct what you call vertebral subluxation. And the subluxation is misalignment of the spine that would cause the nerves to be compressed, or to be, we rather call it pinching, that would cause an irritation to the nerve, and that irritation to the nerve would affect how the area where the nerve supplies.
You actually focus on fascia manipulation.
Yes.
Explain what that is.
Fascia manipulation looks at the 3 planes of movement, and the 3 planes of movement here is bending forward and bending backwards, bending to the side and bending to the side, and rotation. So understanding how these 2 planes of motion and movement interact without tangling is what we would call fascia manipulation. And once we understand it, we are able to address the human body's dysfunctions or pain based on what is not functioning properly, what is not gliding.
How do you differentiate that then from spinal manipulation?
The human body is like, if you may, a balloon. if you want to say that, it's like a balloon. So it's stretched into a given position. But because of repetitive use, because of the food, because of the stress we go in, the balloon can kind of start like wrinkling or like being compressed to lose shape. That now we correct with the fascia manipulation by releasing the fascia. But manipulation means you have to put the patient on the bed and look for which segments on the spine or on the joints that are not properly aligned, and you try using your hands to realign them. That is chiropractic. Fascia manipulation, you release points in the body using your hand, be it the knuckle, be it the elbow, or be it just tips of your fingers.
What is so different between chiropractic and physiotherapy?
Chiropractors are primary care physicians trained to correct spinal subluxation or spinal misalignment. They work independent, not necessarily in the hospital. They can work in the hospital, but most of the time they work in independent clinics. Physiotherapists, on the other hand, are trained as rehabilitation professionals who work in the hospital. So when patients have been seen by a doctor and they have a weakness, they cannot walk, they've had an accident, they have had an injury, they have different problems, then they are referred to the physiotherapist for rehabilitation. Okay, so, and again, physiotherapists treat the same conditions that a chiropractor does, but the tools that both professions use slightly differ.
What else do you see coming through your doors nowadays?
We have patients who come to see us with sinus. We have patients who come to see us with thyroid. We have patients who come to see us with acid reflux. We have patients who come to see us with constipation. And what we do is not that we treat these conditions. It's not that we treat the pathology. What we do, we correct the dysfunction. Organs in the body have to maintain a certain space that they are able to move freely. Whenever that space is not there, then the body is tight. So as we work by restoring that organ space so that the body can use what we call innate intelligence, or rather the ability for the body to heal itself. That intelligence, that ability of the body to heal itself is what we tap into to help the body heal itself.
Mm-hmm. Yes. We mentioned about fascia manipulation, and somebody is wondering what is that and where is it in the body? And you had earlier mentioned you can show us literally where you can find that in a piece of meat.
So the human body, when we skin the animal, most of the time we see a white stuff like this. When you just remove the skin, the fascia is not only under the skin. The fascia is in every part of the body. So assuming the skin was here, and this is the first part you find, I would call this the superficial fascia. Mm-hmm. Okay, the superficial fascia. You can see it's tough. Okay. It's tough. You cannot pull it easily. Yeah. Now, when we pull it slightly, we have this nylon. You can see there's a nylon. We have this nylon that is, you can see it's permeating, or rather is going through different through the meat in different layers. This is the fascia, and this now, if you go slightly deeper here, this is the deep fascia. So we have the superficial fascia on the very top. Then when you go down, this is, we call them, these are ligaments. They are like fat areas where fluid passes through. Okay, in between this. And then when you go deeper now, you find what is called the deep fascia. This is the deep fascia, this one, which is like strictly adhered to the meat. Okay, and that's fascia also is still penetrating. If you look at the meat itself on the inside, you have a lot of white stuff. If you also look, there's a bone here.
Yes.
A bone is also made of fascia. Bone is actually nothing else other than fascia also. Okay.
Which explains why you can't only look at the skeleton, you have to look at the fascia.
Yes, you have to look at the body as a whole. So you have to look at the body as a whole. You have to look at the bones, yes, but at the same time you have to look at what are the components, what are the soft tissue elements that are make the same body.
Okay, so we've touched on the various injuries that walk through or needs that walk through your doors, and today we have Abby as your patient who would like to understand what her condition is and what needs she has today. And you probably can walk us through, when a patient comes here, what is the first point of contact?
Okay. When the patient walks into our clinic, the first, it's at the reception. And when Abby came, the first thing we did is for her to fill an evaluation form or an assessment form. This form kind of carries one, patient information and the consent that they are ready for the treatment.
Yes.
And Inside is a detailed form of okay, we have a body image so that the patient is able to mark for us where they have pain. And the next thing is that we have a detailed chart that we use to be able to ask specific questions in regards to what the patient has presented with, for us to be able to come up with a diagnosis. And once we have come up with a diagnosis, for us to be able now to formulate what we're going to be able to treat.
Okay,
Yes.
so I will leave you and Abby to it so that we understand what brings her here today.
Super. I would like to know, what can I do for you?
So Dr. Hamisi and Abby are back with us again. So Dr. Ari, we left you doing the diagnosis. What are Abby's needs?
So we found that Abby has a pain in her left shoulder, and at the same time she has a pain on the foot, but the most bothering one is the pain on the shoulder. And from that pain in the shoulder, we need to investigate more and see what happened. She has a history of a road traffic accident, and from that road traffic accident, she was wearing a safety belt, and she says she was hanging by the safety belt by the time they got rescued. So what I want us to do is, first of all, to be able to look at the alignment of her leg from down up, so that we can see if there's any change of weight distribution left, right, and left. Valerie is also a provider. She's also a fashion manipulation therapist, and but she specializes a lot on the imaging part of this, the functional imaging. So she's going to take over and explain and do the scans and also explain to Abigail also.
Okay, so Valerie, Abigail is in your hands now, or we shall call her Abby for purposes of what we are doing today. Where do we start?
So we begin with the 3D body viewer. Basically, it will just take an image of her from her foot and give us a 3D animation.
And this is it?
Yeah, this is the scan. So I'll just instruct her what to do. So Abby, remove your sandals, yes. Place your right foot on the clear window.
Right here?
Yeah, go up, place the left one on the black surface. Hands by your side, and just relax.
So exactly what is going on right now?
So basically, the scan uses infrared and laser rays. Both are non-invasive, meaning they are not harmful to the tissue or the body. But it will take more or less a 3D animation of everything Abby is, how she's distributing her weight on both her feet, and then tell us how that is interfering with her posture.
Okay, so it looks like it's done doing that.
And then you change your feet now.
Okay.
Yes.
So this one comes to the side?
Yes.
Yes, clear
And then-
surface. Yeah.
There you go. Stand like you would stand anytime.
On a normal. Actually, yeah, she hunches a lot.
Yeah.
So we shall leave Abby getting her full body scan, and we'll understand her body structure right after the break. Remember, the conversation today is chiropractic. After the break. Thank you for staying with Health Diary. Our conversation again, chiropractic. We see a lot of your questions coming through, but hey, let's continue with this process. Earlier on, before we went to break, Abby was getting her full body scan. Now we need to understand how her body structure looks like. So Valerie, what are we looking at? What are the results saying?
So you see on our right is a sample scan of how we should distribute weight on our feet. Maroon means maximum weight. Like when you stand, that is the toes, the forefoot and the heels should bear most of your weight.
So the red parts are the pressure points.
Yes.
Okay.
And then the light green is mild pressure. So it's just touching on the ground, but not a lot of weight there. The blue is the arch. You know the space between your feet when you stand? Yes, now it's represented by the color blue.
Okay.
But then this is the perfect level. And then here on our left is Abigail's feet. So you can see Abigail is placing all of her weight everywhere on the foot.
Yeah.
If you just compare the two, yeah. But even if you ignore the sample scan and compare the two of her feet, you see the difference between that arch
and
that
this other one.
Yes.
I was almost asking, is it because she has flat feet, but you can actually see there's an arch here
Exactly.
and a slight one here. Also, there's a missing toe.
Yes, on both. This one is barely touching the ground. This one is trying to, but you can see she only stands with 4 of her toes.
Okay.
That's where she distributes her weight.
So what does that tell you?
So this is telling me that she is literally dropping her arch. Okay, so this is what is expected of someone when she stands, and this is what she's portraying. You can see the pelvic tilt on the right side, but then the body compensates by dropping. So there's this curvature of compensation that Abby is taking this way. But there is constant compensation. This is what she is, and then this drops. So when you look at her, it's an upright structure, but it's a compensatory structure.
So one part of you compensates, the other side that slumps.
So this is how she is. If I'm to let her really understand. There's an arch maybe from texting, and you can see the pain location. There'll be a lot of strain on the shoulders.
On the shoulder, which explains why she has pain on her shoulder.
Exactly. And then there's the back and the hip.
Yeah.
You can see how the body is actually compensating
for
pain. Hence, pain on the back and on the feet.
So, Abby, do you have pain in the back too?
Crazy. So true. I have like literally pain exactly here and here, literally on those areas.
Where do we move to?
So now we have checked on the structure. We go check on muscles and nerves. And of course, the basics, heart rate and temperature.
Okay, so
we move on to the next room. This way.
Begin scan.
So Valerie, what exactly are we checking for?
So we are checking for nerve tension. Just something you should remember is that the nerve tension does not state where her pain is, but where the problem with the nerves are.
C2.
Okay, that's it.
Yes, that's it. So if you take a look at the animation on our right here, so we'll just explain the colors. So white means okay tension, green means mild, blue means moderate tension, and red means severe tension.
And she has a lot of reds.
She does, especially on the neck, on the shoulder, left shoulder, and you can see around the scapular region on the right.
And that shoulder is where you are aching, right? Okay.
Okay. So this does not only tell us where she's aching, but how her organs are related to it. The signs Abby may be experiencing, has or will, if that tension is not taken care of. This goes to the stomach and the pancreas. So you find out that there is a lot of indigestion, Crohn's disease, blood sugar challenges.
She's shaking her head in agreement. She's been dealing with these symptoms, yeah?
Weight management, reflux, and digestive issues. So at this point, the patient or the client agrees with you because these are things, they're not new to her. They're things she's been experiencing, but taking medication for the symptoms, but the causes are just the nerves tension, the tension around her body. And then now this is where we touch on the reproductive system, especially in women. So as that is nerve at L5. That's the large intestines, the bladder. So it doesn't mean she's bedwetting right now, but give it 40 years. The nerve to the bladder is weak, so it becomes an issue to retain urine. Yeah. And then there's, of course, the reproductive system, a lot of infertility. There's postpartum back pain, menstrual cramping, which is never as normal as we want it to be. There's endometriosis, something we are fighting to date, pregnancy challenges and delivery positions. So this is all what comes with if that nerve continues being tight and under tension. Then it makes the uterus function less. All the things we complain of are just symptoms of underlying causes. Okay. The next scan, I'll use these cords against her back once again. They're not going to be painful. Nothing is.
Begin scan.
This we're checking on muscle tension. Are the muscles weak or tight?
C5.
Because both will mean pain. If you are weak, there's pain.
C7.
And if they're tight, there's pain. There's no way out.
D1.
So what do the reds mean? Because they seem to have increased.
Now, this tension, we'll do a movement screen, okay? And under the movement screen, we're going to find, is it tightness or is it weakness? And exactly where is the problem? Is it the hips, back or the shoulders she's complaining of.
Okay, so from here, where do we go to?
We check on the heart rate and skin temperature.
Okay.
Place your 3 fingers here, push them in until your mid finger can touch a little button at the bottom.
Okay.
Good?
Yeah, I can touch it.
Okay, so the scan requires us to be very silent. So your average heart rate is at 77 beats a minute. Range is 60 to 100, average is 72, so you're good. So let's take a look at how she responds to her stress levels. There are 2 ways our body respond to stress or respond to anything, the sympathetic and the parasympathetic. So the sympathetic means flight or fright. When you see a tiger, you get scared and you take flight. Simple. And then there's the parasympathetic. Once you are relaxed and fine. You see the maroon? This is severe, moderate, mild, and optimal. Okay, so the white dot represents you. And where I'm placing my mouse here, that's where we are supposed to be. So that when we are not under pressure, being left in a room for 3 minutes silently, there's no tiger, there's nothing. So you're supposed to be balanced, not overreacting, and your body should not be like low.
So essentially, you should be in the green zone.
Essentially, yes. But where she is right now is also very perfect with this lifestyle of hers. So yeah, she's not badly off. You can see her score is 84. It should be at least 80. So how her body is handling her current stress is good.
So help us understand, Valerie, why is it important for you to check her stress levels, considering we came here to understand her body aches?
Okay, so something you should know, Abby has 3 pillars. Everyone, you, me, everyone works with 3 pillars. The mental system, the metabolic system, and the nutrition, the physical system. Now, if Abby right now, you guys just go ahead and she goes home and she gets fired, or she finds out a very tragic something has happened at the home. When you come back, her shoulder pain is twice the pain. So pain is fueled by our stress levels.
Okay, so from here, where do we go?
From here, we will take Abby to do a functional movement screen to just find out exactly which part now is the cause of everything we just find out, okay?
Okay.
So I'll take her to our sports scientist and she'll perform the test.
Okay.
Okay. This way.
We have a number of wrong swimming techniques. You will see river style, which is the most common. Most of us grew up doing that when we were swimming without our parents knowing, where you kick either very hard, your head is not in the water, your strokes are not complete, you're kicking too hard and your knees are protruding from the water. We also have another one that we call doggy style, similar to river style. So you're propping up using your hands and your legs. We have a lot of people who also get in and swim almost half of the swimming pool when they're underwater. You need to breathe, you need to see where you're going, so those are some of the wrong swimming styles that we have.
Okay, so we shall leave it at that on this episode. On the next episode, even as we still talk about chiropractic, we shall follow Abby in her other tests, because remember, we're here to cater for her needs, which are her shoulder pain, and from there we shall be told what kind of treatment she will require. Well, it has been Health Diary. My name is Gladys Gashanja and we've been coming to you from the Premier Rehab and Wellness Center here in Nairobi. Until next time, see you. So we leave, what's her name? Karibu nimwite Valerie. Here, nimesema Center Marawa, sorry.